welcome to the information session on the Practical Nurse Program and the Personal Support Worker Program here at NBCC. My name is Tara McKinnon, and I'm one of the coordinating instructors for programs here in Washington.
And I am Joanne Ellison, and I'm also one of the coordinating instructors.
So I guess the idea of today is that we are going to provide you with some information on these two programs, hopefully be able to answer any questions that you might have and point you in the right direction. If further questions should come up about the courses, the programs, and applying. Here at NBCC, from the very beginning of the programs, you're definitely going to feel like you're part of a team, okay? And you're going to learn from each other. The main goal here for our programs is to provide you with the education that you need in order to provide safe, competent care to your clients in a variety of different settings. As far as campus locations go, we have campuses situated in St. John, in Fredericton, in St. Andrews, in Moncton, Miramichi, and Woodstock. You're probably wondering what specific things will I be learning. So we're going to go into and explain a few of those things. I think the most important thing to realize is that in the nursing profession, you're constantly learning. In order to stay current with all the changes that are occurring, we have to stay on top of that because, like we said, learning is lifelong and things are constantly changing. So a few of the courses you'll be taking, and I'm going to go through this list. The only exception is Foundations of Home Care. That is solely taken by the PSW students. Everything else on this list is actually taken by both the PSW students and the Practical Nurse students. So again, these are only a few of the courses, but I did want to point that difference out. So anatomy and physiology. So that's where, you're going to learn about how your body functions normally. You're going to learn about every system in your body, whether it be the gastrointestinal system, the cardiovascular system, your musculoskeletal system. So we're going to learn about all the normal functioning of all those body systems. Pathophysiology. So that is basically when you're learning about common disease processes and how we would manage them as healthcare professionals. Basic nursing skills. This is where we start learning such skills as bed making, bathing, feeding our clients, our residents, helping with mobility, nutrition, all of those things. So those are just a few of the skills that you'll be learning at the very beginning of the program, but there are a few of them. Basic health assessment. This would be where you would learn to obtain vital signs, do head-to-toe assessments on your clients, and general assessment techniques and holistic health assessments. So looking at the person as a whole. Human growth and development, which mainly focuses on promoting healthy living across the lifespan. Elder nursing concepts focuses on promoting healthy aging. And Foundations of Home Care, like I say, is not taken by the PN students, but it is taken at the end of the PSW program by the PSW students. And it's taking everything that they've learned up to that point and helping them apply it to providing care for somebody that remains at home. So where will you learn? You're going to be learning in a variety of different environments. So, a lot of your studies will take place in your own home, where you're going to be studying and reading and watching videos online of things that you've learned in class or things that you've learned in the lab. You're going to be learning a lot in the lab, where you take that theory that you've learned in class and you apply it in the lab. We have some state-of-the-art mannequins and other equipment in our labs, and you'll be doing a lot in respect to that. And clinical settings. So once we've learned in the classroom, we've taken it to the lab and we've applied it, we're then going to advance to the clinical settings. And in the beginning, that would be in your long-term care facilities, where we'll be working with residents at those facilities in applying what you've learned. So the personal support worker program. Although there are many similarities between our personal support worker program and our practical nurse program, they are in fact two very different programs. So we're just going to discuss those separately right now. As a PSW, you're going to become a member of the healthcare team. Therefore, it's really, really important that you're able to communicate professionally and effectively. So we do teach a lot when it comes to communication skills, ethics, collaboration. It's necessary that you're able to collaborate with the other members of the healthcare team in order to provide the best care for the patient. You're going to spend a great deal of time learning how to collaborate effectively with those members. As part of the healthcare team, our main priority will be to help our patients meet their goals. And in order to do that, all members need to be able to work together. The length of study for the personal program is 10 months. So it starts in September and runs till June at our campus. There may be other campuses where it's offered at different times. But basically that 10 months is a combination of both theory and practical as far as lab and clinical setting.
The practical nurse program is Tara's. The first 2 terms of the year, PSW students and practical nurse students are together and they take the same courses. Then in the spring term, the PSWs are nearing the end of their program and they're going to branch out and they're going to take their foundations of home care and then go on to their preceptorship. The third term for practical nurse program, there's still more theory involved. The practical nurse program is a 2-year program and it starts either in January or September, depending on the campus that you're in, and runs 2 years straight through. You do get some time off, obviously, a break in the summertime. The difference between the programs is obviously the length and time, but also practical nurse students will learn more advanced skills, possibly more acute skills as well. So you'll also be taking some specialty courses. So you'll learn about pediatrics and maternity. You'll do some medication administration courses, psychology, things like that, that will really advance your learning and provide more opportunity for you to work in a broader sense. So as I said, the advanced skills have included what I said, about medication skills, IV therapy, it involves immunizations, which is another advanced skill. Also phlebotomy, which is taking blood. So those are just a few of the skills that you will learn, doing wound care, having the ability to do foot care. There's a lot of learning that can take place in the last year of the course. So work integrated learning. Tara had mentioned that where you will learn is the classroom, the lab, and then your practical part. The practical part is what we call work integrated learning. And work integrated learning is where you are out in industry, you are in the nursing home or long-term care facility, you are in hospital or acute care, or possibly in community. And that is where you are actually working in industry. So you are actually doing hands-on work in the profession that you are learning how to manage. It's experiential learning, meaning it's going to add depth what you've learned in the classroom, add depth to what you've learned in the lab. And this is when we really see students will say, the light bulb went off. Things are really starting to come together here. So it's making more sense. So it really does solidify your learning. The benefits of it is that number one, it solidifies things, but it also gives you a more true understanding of industry and the profession. You're going to be working with the actual professionals in that field. And so you get a better understanding of the roles. And you are there to ask questions, and they are more than happy to answer those questions. So another benefit too is that typically after you are doing this work integrated learning, it increases your chance of employment afterwards. Which for this profession, there's no issue with employment. People graduate and pretty much walk into a job.
So acute care versus long-term care, both of these programs prepare you to work both in the long-term care setting and the acute care setting. With long-term care, as far as being a PN or a licensed practical nurse, comes the opportunity for you to take more of a leadership role in that setting. With our PSW students that graduate from our program, many of them work in the long-term care setting, and like Joanne said, there seems to always be opportunity for employment. As far as in the acute care setting, there are certain units that employ PSWs depending on, on where you are, where you're located. It is a bit more limited than employment opportunities for LPNs in the acute care setting. But what comes with the acute care setting is that ability to, to utilize those advanced skills that you've learned in the program, those more advanced skills. So I think any of us, would say that when we think of nursing, we think of caring, and it is actually, it is indeed the foundation of nursing. Caring is. So many of the courses that you're going to be taking part of are going to help expand your knowledge and your ability to care for a variety of different clients, in a variety of settings.
Professional designation. Currently, personal support workers are not a regulated profession, but may likely change in the near future. An LPN is part of what they call a regulated profession, meaning it's licensed. So at the end of your 2-year program, you are required to write a national exam. And if you are successful, then you will obtain your practical nurse license, your licensed practical nurse. And this is something that is required to practice as an LPN. It is a one-time exam. You just need to write it the once, but you have to renew your registration every year. And the link is there for the Association of New Brunswick LPNs. And if you want to, check that out, it gives you information on what the association does. And it's really about protecting the public and protecting the practical nurse. But having the ability to self-regulate and be part of that regulatory body means that you are making a commitment to the public that you are going to provide the adequate care which is necessary.
Employment opportunities. So in our area, two largest employers would be Horizon and Vitalite. So if you're looking for a challenging career as either an LPN or a PSW in an acute care setting, these are two of our largest employers of healthcare professionals in New Brunswick. So in either of these places, you would have the ability to work to your scope of practice in a variety of different settings, anywhere from rehab to psychiatry, med-surg, palliative care, just a variety of different settings. You're going to be working in collaboration with many other allied healthcare professionals, and generally wages vary, but are usually very competitive, and on average between $20 to $24 an hour. Other employment opportunities, perhaps in more non-traditional roles, would be those in the community. A few listed above here are Corrections Canada, harm reduction clinics, and hospice as well. These are all career opportunities for our graduates here at MBCC. And again, competitive wages are typically offered to our graduates. Long-term care facilities. So we've just put a few pictures up of some different long-term care facilities that tend to offer home care, residential care, and retirement living. So either an LPN or a PSW could gain employment at any of these long-term care facilities. And again, there's generally a competitive income at all these long-term care facilities. And in this day and age, with our aging population, they seem to constantly be looking for PSWs and LPNs. So employment at long-term care facilities seems to be quite common, I guess.
These are just two examples of specialty areas that an LPN may be able to work in. Keep in mind that these would be things that you'd require extra training for, but these are just two of many, many, many. You can get your certification in a lot of different services. Foot care is essentially providing foot care, cutting toenails, doing assessments, people who have diabetes, looking at their feet, maybe doing wound care. It is a very, very popular specialty, and there's a great opportunity for it. Another one is aesthetics. And again, after training, after extra education, you can be assisting with aesthetics. And so things like Botox injection and fillers, Immunizations, subcutaneous administration of medication, those things. So these are, again, are just two examples of possibilities that you could do.
Fran mentioned immunizations, and in this day and age with COVID, just as one example, immunization clinics, are very common and do employ LPNs to safely administer vaccines. Having said that, that is an added competency to which the LPN would have to complete a certain module in order to be able to do that post-graduation. So just to keep in mind that those are employment opportunities, some of which do require, a separate type of certification. Mural as well, there's a wide variety of community services that they offer, wound care especially, post-operative care, phlebotomy, IV therapy, and so many other things. And they as well employ LPNs.
And after gaining some experience, who knows, you may find yourself back here at MBCC. We have a lot of alumni that come back to MBCC, not just in our program, but across all programs all across the province. I know for the PSW and PM programs, we do employ PSWs as well as LPNs and as well as RNs. So that has to say something really good about MBCC. It is a great place to be.
Immunization, just some little tidbits that you should know before applying for the program. Immunizations, because you're going to be working with the vulnerable population, there are quite a heavy list of immunizations that you are required to be up to date on prior to entering the program. If you go on mbcc.ca website, you will be able to find that list. And again, those have to be completed prior to entering the program, as well a medical physical exam that your doctor is going to conduct on you, just to ensure that you are properly physically fit to do this type of work safely. These are to be submitted to student services again. The idea would be prior to starting the program. Criminal record check. Every student has to submit proof of identity. We need an updated recent criminal records check, and that must be for the vulnerable population, because you're going to be working with pediatric patients. You're going to be working with the elderly population. So that is something that needs to be done, again, prior to beginning the program. And just prior to graduation, for the LPN students, the association requires another recent one prior to writing their exam. CPR is another requirement, updated CPR. It needs to be updated every year for our students in our programs. And it's the basic life support for the healthcare provider, which you have to complete and be successful at prior to entering. And if you're in the PN, the 2-year program, you will need to be recertified the following year.
So as Tara said, learning should be lifelong. Learning never, ever ends. So that can be in an informal sense. But formally, MBCC has a program set up to allow students to what we call bridge. So a PSW, or personal support worker who has graduated, can apply to come back and bridge into the practical nurse program. So because you have taken almost 2 full terms with the same courses, when you come back, you can kind of bridge into there. So it'll be just a little over a year more learning and more courses to take. The same as for LPNs. Once an LPN graduates, if they choose to go on to become a BN or a baccalaureate nurse, they can apply through UNB. UNB St. John has an LPN bridging, which, given the shortage of staff and the shortage of nurses right now, it's probably something that's going to be around for a while. You can get information on this at the MBCC website and also at the UNB website.
Dress code. When you're attending classes, there really is no dress code other than obviously to be professional and respectful. But that's a bit different when you arrive for your lab sessions or when you are out in clinical. So when you are in lab or clinical, you are expected to come in uniform with the proper shoes and dressed in an appropriate way with your hair back and all of those specifics that you will learn about when you start the program. We provide an opportunity for students to order uniforms at the very beginning of the program so that everybody has the same uniform that represents basically MBCC with our emblem on it and everything. So to ensure that proper attire, students will be asked to purchase those uniforms through a central supplier of the school's choice.
Fees associated with the programs, they are different, comparable to each program. Information can be found at mbcc.ca under student services. Things that would fall under this category would be obviously the cost of your tuition, but other things to think about are the cost of textbooks, which you can buy used textbooks, you can rent textbooks, you can get electronic textbooks, so there's lots of options there. As well, we require the uniforms. You'll have to wear special shoes, nursing shoes, or appropriate sneakers, possibly a stethoscope, possibly a lab coat. There's other supplies that are associated, but again, this will be passed on to you at the beginning of the program, and exact fees can be found at mbcc.ca.
So, do you need some more information, or do you still have some questions that perhaps Joanne and I haven't really touched on or haven't been able to answer today? If you'd like to visit us, so shadow for a day, that can be arranged as well, and that has been done, in previous years, where if you reach out to the recruitment advisors, we can set up a day for you to come in and kind of take part in our classes, or maybe in the lab setting if that's what interests you, just to kind of get an idea of what a day here at MBCC would be like in the personal support worker or practical nurse program. You can see on the slide, we've got each recruitment advisor for each campus listed, and you can certainly reach out via email or just contacting the campuses and asking for direction to one of these recruitment advisors. They'd be happy to answer any of your questions or arrange a shadow day or anything like that.
On the screen here, every campus and every program has what's called a coordinating instructor. And the coordinating instructor, we are responsible for just ensuring students have what they need, they're on the right, the right roadmap, the right path, any issues or concerns. Each campus has their own. So in St. Andrews, it is Carla Dwyer. In Moncton, it is Tammy Groom. Fredericton, it is Tara McKinnon and myself, Joanne. In Woodstock, it is Cheryl Ann Clark. St. John, it is Betty Lydon, and Miramichi, it is Stacy Gillespie. And you can see on the slide there that the emails are there.
It's time for you to take action. We've given you some information. We've hopefully given you a few things to think about. So today's the day for you to do something for you, something to help change your future for the better. This is a very rewarding career, and not something you'd ever regret as far as increasing your education and your knowledge and becoming part of this very rewarding profession of nursing.
Are you ready to apply? I certainly hope so. So you can do this by going to mbcc.ca, click on admissions, and then you'll scroll down and see how to apply. And it is certainly a very easy step-by-step instructions to guide you through the admission process. There are different processes or different applications, I should say, for permanent and Canadian residents versus international applicants. But again, it is fairly simple. Just all you have to do is click. Can't wait to meet all of you.